receiving briefings and a review of our two command posts for this emergency, first at Camp Murray and then here in Thurston County. I think people would be impressed by the degree of organization and the communication of multiple layers of government going on. I wanted to give you some developments since we last spoke. Yesterday we were successful in having the federal government remove a restriction on some of the COVID-19 testing that previous federal rules were frustrating some people getting their testing done. Previous federal rules, in effect, prohibited people with relatively mild symptoms who had not been hospitalized from being tested. And I spoke to the Vice President yesterday and urged the federal government to remove those restrictions, and also spoke to Dr. Redfield, who heads the CDC, last night. And the federal government, I'm pleased to say, has removed those restrictions. So we now have been given a green light to increase the frequency and protocols under which people can actually be tested. I know that people have been frustrated by that. So that was a good thing that the federal government did to give us the green light. We are continuing to build our capacity under the understanding that we will need additional capacity for testing. As you know, we increased the public lab for our state lab by about tenfold in the last 2 weeks. The University of Washington has now come online. They started their testing, I believe, 2 days ago. They are continuing to refine some of their activities, I'm told, to essentially dial in some of the parameters on their equipment. But we're told that that will increase, hopefully significantly, in the upcoming days. We do want to reiterate, though, that we anticipate the need for scale of testing that will require the private sector to help out in this regard. We need to have the private labs to come to the front lines on this. So we are talking, and the federal government is talking to private labs to increase their capacity as rapidly as possible. We can use a lot of federal coordination on that to be able to approve their operations. So we're hopeful that the scale of that testing capacity can continue to build it as rapidly as possible. I'm going down this morning to see our Maple Lane facility. The state has stood up a facility to help people who need isolation to be cared for while they're in isolation, and I'll be going down to inspect those facilities this morning. We're pleased to see King County has essentially announced an acquisition of a motel for that purpose and use essentially of some trailers or RVs on a short-term basis for the isolation of these folks. So that's the most recent report. I know that there are concerns of folks for paying for this test. We are evaluating if there is some state or other assistance to provide that for people who have difficulty in that regard. And we're evaluating options in that regard. We're hopeful that there could be some relief for folks in this regard. We hope to be able to say more about that in the days to come. I want to, in regard to the message we've all talked about our ability to all be leaders on this, particularly on washing our hands, essentially covering our coughs, isolating ourselves if we do have symptoms. And the one issue, again, I want to repeat, is the most important thing for Washingtonians right now is if you do have symptoms, you need to stay home. You just can't go to work. It's too risky at this point for everyone, your coworkers and your loved ones in the community at large. So we really need to do that. And I want to tell folks that I understand that that's harder for some people than others, both because of their jobs and because of their financial circumstances. I'm glad that the state of Washington has adopted really some of the best sick leave policies so that many, if not most, Washingtonians will have sick leave available to them, and I'm glad that we've passed those laws in the state of Washington to help people in this regard. We have seen increasing number of events that are canceled with large groups of people, and as you know, we have encouraged people who are responsible for large gatherings to give consideration whether it really makes sense to carry those on right now or whether it's better to pause those at this moment. And right now we are deferring to the judgment of people in this regard for these organizations. We've seen any number of companies cancel some of their larger get-togethers. One of the political parties has canceled an event. And we think people should be giving serious consideration to that, and we're deferring to their judgment at the moment. Now, that may change. We have emergency powers in the state of Washington to make decisions about that on a legal basis. That could happen. We have not made decisions in that regard. We are closely evaluating all of the science, and I am listening to our health department and our epidemiologists and some of the best, fortunately, we have some of the best scientists in the world today to help us make decisions in that regard. I was just asked by some of the personnel here about planning for schools. Schools at the moment are making independent decisions in their leadership and their communities about their activities in schools. We have been pleased that the schools have been thinking in advance, if schools need to shut down, how to provide educational opportunities online or otherwise. And that planning is going on in any number of schools to date to at least be prepared for trying to make that kind of decision. And we know that's going on. The health department, our state health department is helping school districts in that regard in making decisions. I know people have asked why schools are not just sort of uniformly shut down today, and frankly the reason is there's so many ramifications for families and businesses in that regard that we have to consider. And those things are things we're considering very carefully on a daily basis to try to make the best decision we can for the health and safety and education of our children. Because frankly, that is so interruptive for a lot of people's lives. If you have a child that goes home from school and their parent is a nurse and can't go to the hospital because they have to care for the child, then these are things we need to think about, and we are thinking about those things. So in sum, we encourage people to give serious consideration about their get-togethers where there's a large number of people, and we'll continue to evaluate this on a daily basis. With that, John, would you like to add anything or not?
I think that's well said.
Okay, so thank you, John.
Mike Pence's press secretary just tweeted that the vice president will be traveling to Olympia tomorrow. Will you be meeting with him, and can you talk a bit about what that visit will entail?
I assume I will be. I'm not sure it's been scheduled yet, but I assume I will be. I've talked to the vice president 3 times now about this, and I'm pleased that our request, I assume that he was helpful in making the federal decision to remove these restrictions so we could do more testing, and I appreciate the federal government doing that, as well as Dr. Redfield, who responded to that. By the way, Dr. Redfield last night committed to sending more people to help in our contact tracing issues, which is a very labor-intensive thing to trace people who have had contacts of people who have been confirmed with the virus. He told us last night he will be sending additional people to help our local health department in that expanding activity, which we appreciate. And I've also talked to the Vice President about the stockpile. As you know, we've made requests to have access to the federal stockpile. We believe we're going to have a good result there, and also about opportunities to increase manufacturing of some of the medical equipment that we need. The federal government has emergency authority to essentially, in a sense, commandeer manufacturing capability. We've urged the federal government to think about that. So I know that we will talk about extensively tomorrow with the Vice President about all of these subjects, and I look forward to continuing that work.
Governor, one
more question, we're off to Maple Lane.
Governor, we are hearing from the families of the care center in Kirkland. They're telling us that inside that center, the care is inadequate, the staffing is short, that families are not getting timely and complete information. Can you ask the state to step in to help?
Well, we are, to the extent humanly possible, and I certainly understand the frustration of these families. As the son-in-law of a 102-year-old wonderful woman, I can understand why everybody would be frustrated by this circumstance. It's very disruptive, very difficult, and the anxiety of these families is palpable. So we certainly understand that. We'll do everything we can to help in that regard. I want to also thank our emergency personnel, the Kirkland Fire Department, our police, that were really doing great things for that facility. I know the Department of Health is doing everything they can to assist to increase the confidence of these families that everything is being done. So the answer is yes. I think that the state is doing all it can in this regard. I think the difficulty is, unfortunately, is that this is a very trying circumstances, and I can understand the anxiety of these families. So John, is there anything you can add that, what we could or are doing in this regard?
So the Centers for Disease Control has had folks on the ground with Public Health Seattle-King County who is in the lead on this and have been helping to evaluate the situation there. And I know that's being looked at carefully and decisions are being made moment by moment on the best way to care for folks.
Anything that can be done to add to staff or to improve communication between the center and the families?
Again, I think, as the governor said, we appreciate the challenging circumstances there. We're supporting Public Health Seattle-King County in their needs around this. They're in the lead, and I have been working through our Emergency Operations Center with resource requests for them. So I know that it's a situation that's very dynamic and moving quickly, and we are assisting the local folks as they ask for that.
Let me hold on just a second. If you guys can just defer just for a second. Look, maybe there's something we could do to get cell phones to everybody to make sure that they can talk to their loved one. I will make some inquiries to see if there's a possibility of doing that, if that has not already been done. And I think that we just have to understand the anxiety, and we will look for ways to reduce that. But the first priority is taking care of the medical needs of the patients. I will report back to you if we can get cell phones to these folks so they can talk to their loved ones.
Sir, as a former basketball, what's your take on the high school tournament still going forward this weekend?
Well, it's like I said, we are encouraging all decision makers to seriously consider whether it makes sense under these circumstances to continue. And I hope the WIA, I assume they have given serious consideration to that. We have not superseded my decision making on those local leaders to date. That it may come to that. It has not to date, and we will make the best decision possible at the right decision. But I want to reiterate, these are not the easiest decisions given the consequences for everyone involved.
Governor, what's the scope of legal authority for your office or
I'm sorry?
DOH to? What's the scope of legal authority for your office or DOH to cancel an event like that?
It's very broad. I have declared an emergency under Washington state statute. I'm very confident that was the right thing to do. And the governor does have the authority to limit the size of gatherings of people in the state of Washington. It's a very extensive authority. And we are going to exercise it with judgment. It's going to be based on science. It's going to be based on talking to the community, which I'm doing. I've been in broad outreach with leaders from fire chiefs to school directors to county executives. So we'll make those decisions in the right way at the right time. Thank you very much. Take care.
Secretary?